Have you ever finished an exam feeling confident only to discover you missed questions on the material you actually knew? The truth is, many nursing students don't fail exams because they don't know the material. They fail exams because they answer the questions they think is being asked instead of answering the questions that are actually being asked. Today, I'm going to teach you how successful students approach exam questions so you can improve your scores and reduce test anxiety. My name is Nurse Teri Davis. I am a registered nurse, a nurse leader, a nurse educator, and I am here to guide you along your nursing journey wherever you are in that journey, whether you are a new nursing student, a new nurse, or you have been in the game for a long time, you're on your leadership trajectory, or even if you'd like to become a nurse entrepreneur. Let's get into this video. All right. Point one of the biggest mistakes nursing students make is immediately scanning the answer choices. Please don't do that. Before you even look at the answers, read the question carefully. Identify exactly what they're asking for. Ask yourself, what is the question asking me to do? Sometimes the question contains multiple instructions. It might ask you to prioritize an intervention. What should the nurse do first, right? Which finding requires immediate follow-up? Those are all different questions requiring different thinking. I often recommend mentally highlighting keywords such as first, priority, best, most important. Those words tell you how to answer the question. Point 2, follow every instruction in doses calculation. Many students lose easy points because they ignored part of the question, part of the instructions. Always ask, does the question require kilograms? Does it require pounds to kilograms conversion, right? It may be a pediatric patient. It may be a dose that is weight-based, right? What about, does it want the answer rounded to the nearest tenth, to the nearest whole number, right? You understand what I'm saying? Don't jump straight to the math. Step 1 is convert weight if necessary. Step 2 is to then calculate the dosage. And step 3 is apply the rounding instruction. One missed instruction can make a correct calculation become a wrong answer. Point 3, determine what nursing process step is being tested in this question. This is where many students get tricked. The answer may look correct clinically, but still be the wrong answer on the exam. Okay, you want to ask yourself, which step in the nursing process is this question testing? You got to look at the nursing process. Add pie, assess, diagnose, plan, implement, and evaluate. Okay, for example, if a question asks, what should the nurse do next? Students often choose an intervention. Take the blood pressure. I don't know, that could be an assessment. Or apply, let's say, give anti blood pressure, decrease in blood pressure medication, or give the patient some glucose to bring the blood sugar up, right? Don't answer that way, right? Because you want to, it sounds emergent, the question sounds emergent, but you want to go ahead and do something to save this patient's life. No, you do need to assess first before you intervene. You want to Check the blood sugar. Check the blood pressure. Contact the physician, right? You have to assess first. You have to gather the data first, okay, before you do anything. But the key is to see exactly and acknowledge exactly what the question is asking you, okay? Don't skip that step. Point 4, watch out for what looks right, the look right answer, right? Nursing exams often include distractors, unfortunately. A distractor is an answer that sounds reasonable, but doesn't answer the actual question. Ask yourself, does this answer solve the problem the question is asking? Could a nurse do this? No, don't do that. Answer to solve the problem. Not, there are several actionable steps, but your job is to identify the best action. The best action. Not, yeah, the nurse could do that, yeah. Well, the nurse could do several things. What is the best action? Not what appears to be right. You understand what I'm saying? All right, let's go to the next one. Point 5, use priority framework. When you're stuck between two answers, use nursing frameworks. Ask yourself, is this an ABC question? You know that big one, airway, breathing, circulation, okay? Priority, right? Is this a safety issue? Could somebody get hurt? Could somebody get killed? Could somebody die on my watch, right? Is this an acute or a chronic condition? Is the patient stable or unstable, right? Is there an actual problem versus maybe a potential problem down the line if I don't address this? You know to prioritize, right? These frameworks help you to identify the highest priority answer. All right, point 6, slow down to speed up. Students often rush because they're nervous, and trust me, I understand. I have been there. Ironically, rushing creates mistakes. Take a few extra seconds to just read the question, identify the key words, determine what the question wants, and just scribble it down somewhere, right? And then eliminate the wrong answers. Those extra seconds can save multiple points on the exam. In closing, if you remember nothing else from today's video, remember this. Don't answer the question you think is being asked. Answer the question that is actually being asked. The students who consistently score well aren't always the smartest students in the classroom. They're the students who understand how nursing exams are designed and who approach every question strategically. Read carefully, follow the instructions, use the nursing process, think like a test writer, and watch your scores improve. All right. I think that is good enough. I think that is good enough to get you winning at test taking in nursing. If you're a nursing student, new nurse, or future nurse educator, and you want practical strategies that help you succeed, subscribe to Nurse Teri Davis Leadership Community. We're building confident nurses, future leaders, and nurse entrepreneurs one lesson at a time. Thanks for tuning in and have a great day. Bye.